last session, so I can be very funny or very quick. I'm going to do very quick. Thank you very much. That I read about the history of people's understanding of bees. So it was only until, excuse me, the 18th century that people began talking about the queen bee instead of the king bee, because until then they couldn't understand that all these organisms can be run by a female instead of male. You can't have a female in control, according to people's understanding. So I think of that when I think about the patients in the healthcare system. So you all know this is the healthcare system. It's fragmented, it's messy, and it gets more and more fragmented because all of modern medicine is built on specialization. A specialist who knows more and more about less and less of the patient. And the healthcare system forgot about the patient as the commonality across all the providers, and also forgot that the patient is now the newest and possibly the best provider of care. The majority of healthcare is delivered by the patient taking the medication or not, doing their exercise or not, changing their habits or not. So the approach that we took was that if everything goes through a single record that's owned by the patient, that goes wherever the patient goes, that solves the integration problem, but it also solves the capacity problem because the patient now begins to understand their body, they begin to understand what they need to do, and they can do it more quickly and more cost effectively because right now it's happening to them. They can take action. So the inspiration is for me, if you look at patients for the longest time, they recognize the problem, they feel the problem, and so they have always been inventors. If you look at thalidomide in the 60s, all these babies who are born with limbs that are shorter, the first instinct of people was to build them prostheses to make their limbs look longer so that they make you feel less uncomfortable about looking at a person who's different to you. But the prostheses they got, they couldn't drive, they couldn't eat, they couldn't use them to manipulate things. If you contrast that with this gentleman who had an amputation and the prostheses which were designed for appearance, he couldn't walk. So he designed a completely different prosthesis, which is about speed and walking. So now these athletes can run faster than normal people because he is figuring out how to solve the problem he is facing rather than the problem others may feel in looking at the patient. And this has always been the case, so I didn't realize, but Graham Bell's mother was deaf, that's why he invented the telephone. Edison was deaf himself, that's why he invented the phonograph. Now, you don't have to be Edison to be helpful. I think all of us in healthcare can start fixing the problems if we have the data to help understand what to do and when to do it. So we began doing this, as Hans was mentioning, over the last few years. And what we've proved is if you give the data to patients, it's obviously the nice thing to do for the patient, but it's also cheaper, safer, more and higher quality because the patient can do things sooner. And the sooner they do things, the more you avoid progression of disease and the more you avoid expensive treatment. But you can go further because this actually helps the planet as well. So when you go digital, when you intervene sooner, you emit less carbon into the environment. And now we make the system available to any educational institution. This is live in many medical institutions in the UK. If anyone would like to use it in the Netherlands or the rest of Europe, we'd love to make it available. The patients teach the medical students in the curriculum how to work in a world where the patient knows more than the doctor does. So these students, when they graduate, they're not embarrassed about the patient knowing more than they do. They know how to behave and how to build on the patient's knowledge and bring them into the team and build on that system. So I want to talk about scale. So where we are today, we have 30% of the UK under contract. And when COVID hit in 2020, part of the nation's response to COVID was to make data available to patients in the NHS app. So this is the national app in England. In February 2020, part of the COVID response was they switched on Patients Know Best within the NHS app so it could make a lot more data available to a lot more people a lot more quickly. And now we're doing the same thing in Wales. If you're watching Brexit closely, the UK is 4 different nations that you might have learned from the TV. So we also work with the Dutch government. So the Dutch government has pioneered financing for giving patients data. It's done in a very Dutch way, so the Dutch consumer is the one that chooses. The government hasn't chosen anything, they just certified a minimum amount of quality. And based on what the consumer chooses, the Dutch government makes payments for the people who deliver that service. And we work with CarePoint, and the last time I came here in 2016 was when I met Jon from CarePoint. So these events, VBHC has a big place in my heart. So the last thing I'm going to finish with is this is what the Dutch hospital Radboud is doing, and I think everyone should do this for every specialty in every country. So what they did was build a platform on top of the patient's best record for all chronic myeloid leukemia patients in the Netherlands. And now they're expanding this to other blood cancers and then to other diseases. So all the data goes into one record, and they focused on CML because CML is a condition where if you take the medications correctly, over 5 years, you are cured of the tumor. But the medication has side effects that are difficult, and so often the patient stops taking them. But the longer the time between you stopping taking them and the doctor knowing, the more the chance that you might have the cancer again. So it's really important to work with the patient and change the medications for the symptoms of the patient. And even from the doctor's side, the regimens keep on changing. It's very complex, it's very dynamic. So what the people did is they put all the data into one record that goes with the patient across all of these, the 80 different hospitals in the Netherlands. And then they gave a user interface for the patient that says, this is your biological information, your lab results. Tell us what symptoms, what side effects you're having. Tell us how many medications you're taking every day so we know honestly what's your compliance with the regime. And we'll give you advice. So this is, your doctor hasn't done a test result yet, you really should have had one. Ask your doctor for a test result. And based on the biometrics that you have and the side effects that you're having and the compliance you're doing, let's change the regimen so you get the latest personalized protocol for you. And the same thing for the doctors. So they get a list of all their patients, which the ones to look out for. And now they have data from the patient about their compliance and their side effects. And then when they go to each patient, they can see exactly what needs to be done based on the latest guidelines. I think everyone should do this because not only is that more efficient, it then generates a learning system because as they collect the data from the patient and layer it onto the existing randomized controlled trials, they know the next generation of what the therapy should be. And Anton is in the audience from Radboud, if anyone wants to speak to him. So if I stop there, thank you very much for inviting me.
Thank you very much. It's really inspirational what you're and you probably could talk for hours and hours. One quick question. I'm sure there will be some, otherwise I will be asking the questions. How do I get it to my hospital as quick as possible?
If you go to, so CMI Life you get from the treatment team, cmilife.nl, but anything in the Netherlands on patientsnobest.nl, because the Dutch government's program, your data is available through that, and you can use PKB with that to get your data from a Dutch provider.
Sounds great. I'll do that, start this weekend. Right. Thank you so much again, and congratulations with your Inspirational Award.